It is 2 minutes after
This
the hour.
meeting is being recorded.
It's 2 minutes after the hour, so I will say good afternoon now. Welcome to the October 27th Enforcement and Compounding Committee meeting. My name is Maria Serpa, chairperson of the committee. Before we convene, I would like to advise all individuals observing or participating in the meeting that the meeting is being conducted consistent with the provisions of Governor Gavin Newsom's Executive Order N-2920. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. I will announce when we are accepting public comment on the various issues, and the meeting moderator will open the lines. I have advised the moderator to allot 2 minutes to each individual providing comments. This approach is necessary to facilitate this meeting and ensure the committee has the opportunity to complete its necessary business. I appreciate everyone's understanding and patience as we navigate this format for our committee meeting today. I would like to ask staff moderating the meeting to provide general instructions on how to participate at the appropriate times throughout the meeting.
This is the moderator. When the chair calls for public comment, I will open what we call our Q&A panel. In order to access that and provide public comments, you will need to click on the Q&A icon at the bottom of your screen. You will type, "I would like to make a comment," or "I would like to make a public comment" in the Ask field. Submit that request to all panelists, and then we will pause to allow time for submission. Once you've requested your spot to make a public comment, I will call on commenters in the orders that they are received. You will be provided a 2-minute time frame to make your public comment, and I will be providing a 10-second reminder. At the end of that 2 minutes, I will mute your microphone. Thank you.
Thank you. I would now like to take a roll call and establish a quorum. Members, as I call your name, please remember to open your line before speaking. I'd also like to welcome Mr. Jig Patel as our vice chair for this committee. Jig?
Thank you. Good afternoon. I'm here.
Thank you. Greg Lippy?
Here, Maria.
Thank you. Ricardo Sanchez?
I'm sorry, here, public member.
Thank you. Debbie Veal?
Hi, Maria. I'm here, public professional member, licensee.
Thank you. Albert Wong?
Albert Wong, professional members here.
Great, we have 100% attendance. With a quorum being established, the committee will now entertain only public comment for items not on the agenda. To facilitate this portion of the meeting, as I previously announced, the moderator will open up the phone lines to individuals to provide an opportunity for public comment. You are not required to identify yourself, but you may do so. As we open the lines, I'd like to remind everyone that the committee cannot take action on these items except to decide whether to place the item on a future agenda. Do we have any public comment?
This is the moderator. I have opened the Q&A panel for submission of public comment requests. Again, we are displaying instructions on the screen for your use. Click on the Q&A icon at the bottom of your screen. Type, "I would like to make a comment" in the Ask field and submit that to all panelists. At this time, we do have a public comment from a member by the name of Danny Martinez. Danny, I have unmuted your microphone and you will have 2 minutes.
Thank you. Danny Martinez with the California Pharmacists Associations. Good morning. I have 2 requests for future items, please. The first one is for the committee to agendize a discussion on the compounding of methacobalamin, specifically related to what is or is not allowed and recent board actions on licensees as a result of this. Our members have been reporting to us that they have been getting reports from inspectors to tell them to stop compounding methacobalamin even when they are meeting all of the requirements stated in law and providing the necessary documentation to support that. The second thing I would like to request is for the Enforcement and Compounding Committee to add an additional hearing before January 2021. And the reason for this urgency is in relation to the issue on methacobalamin. It seems that there is a conflict between what the FDA and the Drug Quality Security Act is allowing versus what the Board of Pharmacy is allowing, and this needs to be resolved sooner rather than later. Unfortunately, this is resulting in patients not getting their needed medications, patients which include autistic children. Thank you.
Thank you, Danny.
Our next public commenter is Joan Capusnick, and I apologize if I have mispronounced your last name. I'm unmuted your microphone. You will have 2 minutes.
Thank you very much. Joan Capusnick, Uner. Yes, I'm a pharmacist and hold the position of Vice President of Clinical Content at First Data Bank, also known as FDB. Thank you for allowing me these few moments. FDB's flagship product is a pharmacist-curated medication knowledge base. This knowledge base includes prioritized listing of warning labels, also known as auxiliary labels that are affixed to the prescription medication container. Computerized pharmacy information systems utilize these FDB labels and are implemented in the dispensing workflows. I'm here today to notify and to solicit support for wording changes made by FDB to auxiliary warning labels done based on a July FDA MedWatch notification directing pharmacies and health practitioners to enhance labeling to promote naloxone accessibility with the express goal to reduce opioid overdoses and deaths. As background, FDB's mission is to improve safety and led us to publish an opioid-specific auxiliary warning label previously. This label ensures that our pharmacy customers are also in compliance with the amended laws related to California Senate Bill 1109. This so-called opioid regulatory label reads as follows: caution, opioid, period, risk of overdose and addiction. This is a very important label to be on the container of these prescriptions. As a priority, it is assigned to be a 1, meaning that it will always be on a container. As context, a secondary label might read, for example, may cause drowsiness, dizziness, alcohol and marijuana may intensify this effect, and lastly, use care when operating a vehicle, vessel, or machinery. So these are the auxiliary label types. Early this month, after soliciting nationwide input, FDB published an updated auxiliary warning label for opioids. We have
10 seconds.
We have asked to get your input. We should have naloxone on hand in case of overdose or accidental use. We believe this change will promote naloxone to be furnished. There have been issues.
Time has expired. Our next commenter is Joe Gracella. Joe, I have unmuted your microphone. You will have 2 minutes.
Thank you. I would like to have on the agenda, the FDA just made a final memorandum of understanding in regards to compounding. Can we put that on the agenda for the next time? Thank you.
Our next commenter is Doug Holstead. Doug, I have unmuted your microphone. You will have 2 minutes.
Howdy, this is Dr. Doug Holstead. I'm a physician in the Monterey area, and I am a pediatrician who's dealt with autistic children for the last 20 years. I use a very large amount of methylcobalamin, and I would like to make sure that it's available to my patient population. It's not just the autistic kids. It actually helps in all kinds of modes. I have a patient with pernicious anemia that it actually works much better with, but I've had a difficult time getting a hold of it. And part of it is the ability for the pharmacists to produce it. So I'd like that on the agenda in order for me to continue servicing my population. It's one of the most powerful modalities that I'm able to use. Thank you.
Thank you.
Madam Chair, we do not have any further requests for public comment. Would you like me to close the Q&A panel?
Please do. Thank you.
It is closed.
Members having received public comment, I will now ask if any members would like to comment on any of the items. And as a reminder, we cannot discuss the items. However, please indicate if you wish to express your preference for an item to be placed on a future agenda. As a reminder, please remember to unmute your lines.
Maria, this is Debbie, and it sounds like both of these items are worthy of being agendized in a future meeting. There seems to be a lot of angst around methylcobalamin, but I'm not sure, when is our next meeting? Is it, actually it's probably in the
January, I
notes.
believe.
So this is
Anyway, I'll second it.
okay for discussion. I know we can't discuss it, but just for members' background, this topic has been discussed at previous compounding meetings at least twice, and the public was informed on how to obtain the product in a way that meets the compounding regulations in USP. Certainly we can discuss it again, but I just wanted to bring that to your attention, especially in regards to if the motion is going to include an additional meeting. We may want to discuss that separately than just putting the item on the agenda.
Since I'm fairly new to this committee, Maria, I probably was not part of that, and so I would defer to you as the chair on whether it's an educational situation that perhaps needs to be addressed or it needs to be on the agenda.
So Debbie, we do have your motion and Greg seconded it,
Right.
and it's about putting it on the agenda, but it's also, that motion does not talk about having an additional meeting. So do you want to move forward with that motion?
I would like to leave it as is.
Agreed.
Okay, so it's been moved and seconded to add the issue of compounding methylcobalamin to a enforcement meeting as scheduled in the potentially for the next meeting. I can't say all those in favor.
Right.
I have to follow Greg's lead now. Okay. I will call everyone alphabetically, so it'll make it easier for us to unmute in order, so you would know what that you're coming up.
Do we need to have public discussion on this?
Yes, thank you. That's
do we
what
need?
I was going to say.
Oh, sorry. Yes. Are there any public comments on the motion?
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" in the Ask field and submit that to all panelists. At this time, we do have a request from Danny Martinez. Danny, I have unmuted your microphone. You have 2 minutes.
Thank you. And yes, so I do support this motion, and I hope that there's going to be another motion on the meeting before the end of 2020. I just want to reiterate, while this has been discussed in previous items or in previous committee meetings, the issues remain intact, and there has been no finality to that. If we remember the last meeting, there were questions on the ability to obtain methylcobalamin of the suggestions that were made. So we would definitely appreciate another opportunity to discuss this. Thank you.
Thank you. Any other comments?
We have one additional request from Joan Capusnick. Joan, I have unmuted your microphone.
Hi, yes, thank you. I wasn't sure it was mentioned 2 items, but I'm hoping that today the committee will support my item as a future agenda item, or at least advice on disseminating information to help with enforcement-related concerns. There have been issues with inspectors.
I'm sorry, are you regarding the methylcobalamin or your discussion? Right now we're just...
My discussion item. It sounded like it was being voted that both would be on future agendas.
No, We're only, the current motion is about methylcobalamin added to a future agenda. We haven't
Great.
got to your point yet. Thank you.
Okay, thank you.
Any other discussion on adding methylcobalamin to a future agenda?
This is the moderator. We've received no additional requests for public comment.
Okay, I will call for the vote. Mr. Lippy,
Yes.
Mr. Patel,
Yes.
Mr. Sanchez,
Yes.
Ms. Veal,
Yes.
Dr. Wong,
Yes.
and I vote yes. Do we have another motion for items that were brought up during a public comment?
I would consider one. I just don't know what Joan is asking for specifically.
So I can
Well, I think-
just state, oh, I'm sorry, Ms. Veal, did you want to?
I was just going to say, I think that she wanted us to review the auxiliary label, and I would be in support of us discussing that.
Okay, then I make a motion to put it on the agenda.
Okay, and I'll second it.
So the
Thank you.
motion, as I understand it, is to discuss additional auxiliary labels on opioids to assure or to assist with naloxone accessibility. Is that correct?
Yes. Yeah.
Okay, is there any public comment?
This is the moderator. I have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We will provide a moment for time to submit those requests. We have a request for public comment from Joan Capusnick. Joan, you are unmuted. You will have 2 minutes.
Thank you again. In regards to the auxiliary label, considered the regulatory label, it is available now for all dispensing pharmacies and pharmacists. It now does have an extra sentence, and that's the point that is being contested by some inspectors. Caution, opioid risk of overdose and addiction, period, was the original label. We have added, ask your health professional if you should have naloxone on hand in case of overdose or accidental use. I say this just for clarification to everyone.
Thank you.
We have no further requests for comment.
Okay. I will call for the vote for the motion as stated. Mr. Lippy,
Yes.
Mr. Patel,
Yes.
Mr. Sanchez,
Yes.
Ms. Veal,
Yes.
Dr. Wong,
Yes.
and the chair votes yes also. Thank you. Do you have any other motions on public comment? Okay, hearing none, we'll move on to our next agenda item, which is number 3, discussion and consideration of recently signed legislation impacting the practice of pharmacy. Members, as we begin our discussion with the recently signed legislation, as you may recall, it is our committee that reviews such matters to discuss implementation. Historically, stakeholders have requested such discussion to understand how the board intends to implement legislation, including regulating to new requirements. For your reference, attachment 1 in our meeting materials includes a copy of each of the measures. So the first one is AB 1710. This measure provides for pharmacists the authority to independently order and administer FDA authorized or approved COVID-19 vaccines. As indicated in the materials, we have supported this position. Although the meeting materials indicate implementation should be straightforward, I want to acknowledge that recent immunization alert that was released by the board via an email alert. As indicated, the board strongly encourages pharmacies designated pharmacists in charge, and pharmacists to evaluate their practice of initiating and administering vaccines and take immediate corrective action to ensure that their practice complies with the regulation. It is my understanding that a number of inquiries have been submitted via the Ask Inspector website and to staff directly requesting the board evaluate scenarios to determine compliance. Such an assessment must be done on a case-by-case basis with the pharmacy and board staff. I will note that it's my understanding that there is a wide range of processes being used. I would suggest that if any pharmacy or pharmacist is unclear of the current practice, of their current practice, and if it complies with law, that they consult an attorney. Further, should it be helpful, the following questions could be helpful in assessing your operations. First, who is writing the order for immunization, or who is ordering the immunization directly into the pharmacy system? 2, who is interacting with the patient regarding health, allergy, and other information? 3, what functions are currently being performed by non-pharmacist staff, and do any such functions require judgment? 4, to what extent is the pharmacist involved with the system process? Is it just at the point of administration? Specific to this bill, I agree that early education on the measure is important to assure that pharmacists are well positioned to begin initiating and administering COVID vaccines on January 1st, assuming there is an FDA-approved vaccine available. So just as a summary, this topic that is related to this bill that was recently chaptered was sent out as a board alert to pharmacies and pharmacists. So members, do you have any additional thoughts or comments? And as a reminder, please remember to unmute your microphone. Hearing no member comment, I'd like to request the moderator to open up the lines for public comment.
This is the moderator. I've opened the Q&A panel for submission of requests to make public comment. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" into the Ask field and submit that to all panelists. I will pause for a moment to allow time for submission. We have a request for public comment from an individual by the name of Keith Yoshizuka. And Keith, looking for you in my list. I have unmuted your microphone. You will have 2 minutes.
Thank you very much, Keith Yoshizuka, as an individual. I would ask for guidance or clarity in a recent release from Health and Human Services at the federal level. They made a similar pronouncement about the COVID vaccine, only specified that it had to be in the ACIP approved, which is specifically the reason that 1710 was introduced, because the COVID vaccine would not be ACIP approved for several months after it was released. So I think several pharmacists in the state will be conflicted and not sure how to proceed. Thank you.
We have no further requests for public comment. Would you like me to close the Q&A panel?
Please do.
It is closed.
And so into response for Dr. Yoshizuka's comments, I know there is discussion about regulation or policy in another committee. Perhaps staff could remind me as to where this is being discussed in the board that goes to the point of FDA approved and ACIP approved protocols?
Yeah, this is Anne. I think that Dr. Yoshizuka is speaking to pharmacists and their authority to provide immunizations. And pharmacists in California can already do it pursuant to 4052.8. So their authority for ACIP already exists, and the provisions are well established in our law and then the supporting regulation. What 1710 does is it expands that authority to also apply to COVID vaccines that are either authorized or approved. We will be educating to this, and we'll be specific about the provisions in the law that a pharmacist must satisfy if they're exercising the authorities provided in the legislation.
Great, thank you, Ms. Sodergren. I will move on to the next item, which is AB 2077, that extends the provisions for needle exchange programs. As I understand the measure, existing law provides for the authority of a pharmacy to furnish hypodermic needles and syringes for human use without prescription under specific conditions, including knowledge that such furnishing is for a legitimate medical use. Further, the section provides that such condition of furnishing, a pharmacy must also provide information on access to drug treatment and access to testing information and information on the safe disposing of Sharps waste. I agree with the comments in the chair's report that we include this in the pharmacy law update for 2021 and also in the script. I don't believe additional action is needed beyond that, but would appreciate any thoughts from the members. Members, remember to unmute your phone or your microphone if you have any comments. Hearing none, I think we go to public comment.
This is the moderator. I have opened the Q&A panel for requests for public comment. Please click on the Q&A icon at the bottom of your screen. Type "I would like to make a comment" in the Ask field and submit that to all panelists. I will pause for a moment to provide time for submission. Seeing no requests for public comment, would you like me to close the Q&A panel?
Please do, thank you. We'll move on.
Thank you, it is closed.
Thank you. We'll move on to C. AB 2113 would require the board to expedite applications for an applicant who supplies satisfactory evidence to the board that the applicant is a refugee, been granted political asylum, or possesses a special immigrant visa. And in reviewing the information provided in the chair report, I don't believe this measure will have an impact on any enforcement perspectives. However, I note that the staff will need to make changes to forms and other items in order to implement. The staff also recommends developing an FAQ to provide guidance to applicants, and as implementation evolves, it may become necessary for us to promulgate regulations. Members, do you have any comments? Hearing none, we'll go to public comment.
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type "I would like to make a comment" in the Ask field and submit that to all panelists. We will pause for a moment to allow time for submission. Seeing no requests, I will close the Q&A panel at your direction.
Thank you. Next item on the agenda is AB 3330. Please note that the board did not discuss this measure. This measure increases the cures fee that licensees pay to support cure system operated by DOJ. The amounts are indicated in the meeting materials. I agree with the implementation details in the chair report and would encourage the board to send out reminders also as the implementation date comes closer. Members, do you have any comments? Hearing none, let's go to public comment.
This is the moderator. I've opened the Q&A panel for public comment requests. We're displaying the instructions on the screen. If you'd like to submit a comment, please click on the Q&A icon at the bottom of your screen. Type "I would like to make a comment" in the Ask field and submit that to all panelists. I will pause for a moment. Seeing no requests for comments, would you like me to close the Q&A panel?
Please do, thank you. Next item on the agenda is SB 878. This measure requires the board to post its application and renewal processing times. Included in the licensing committee report to the board, application times are already posted. Members, do you have any additional comments? Hearing none, let's go to public comment.
This is the moderator. I've opened the Q&A panel for public comment. If you'd like to make a public comment, please follow the instructions on the screen, entering "I would like to make a comment" in the Ask field of the Q&A panel, and then submit that to all panelists. Seeing no requests, I will close the public comment.
Thank you. Lastly, for this section is SB 1474. SB 1474 extends our sunset date for 1 year. While preparing for the board meeting scheduled to begin later today, I noted that the board's executive officer will be providing an update on the sunset process. Members, do you have any additional comments? Hearing none, let's go to a public comment.
This is the moderator. I've opened the Q&A panel. We will pause for a few moments for members of the public to submit their requests for comment. Seeing no requests, I will close the Q&A panel.
Thank you. Moving on to item 4 on our agenda, discussion and consideration of compounding animal drugs from bulk drug substances, including federal law and the FDA draft guidance. Members, as you may recall, during the July board meeting, the board received a request to agendize a discussion on this topic. At the time, I requested staff to review the matter and determine if any changes had occurred in federal law. Subsequent to that, in late August, CPHA submitted a written request as well. While there have not been any changes to federal law, this has been confused recently with the FDA's attempt to provide guidance and deserves discussion. This is a somewhat complicated issue, and details are in the chair report. We also have legal guidance from our counsel to assist us in understanding the responsibilities of the board. First of all, we start with under the Food, Drug, and Cosmetic Act, compounding of an animal drug from bulk drug substances results in a, quote, new animal drug, unquote, that must comply with the Food, Drug, and Cosmetic Act. The FDA has historically exercised enforcement discretion with regards to animal drug compounding from bulk substances under circumstances when no other medically appropriate treatment options exist. Further, information on the FDA website provides what current law states. Current law states the specific conditions under which extra label use from compounding of approved animal drugs or approved human drugs is permitted. The compounding must be in compliance with all relevant provisions. The extra label drug use regulation does not permit animal drug compounding from active pharmaceutical ingredients or bulk drugs. This is the current law. In November 2019, the FDA released for comment draft guidance entitled Compounding Animal Drugs from Bulk Drug Substances. The FDA noted that the draft guidance would advise veterinarians on when the FDA does not intend to take action for certain violations. When pharmacists or veterinarians compound or oversee the compounding of animal drugs from bulk substances. The comment period for this draft guidance has been extended on 2 occasions, with the most recent comment period expiring on October 15th. Although still in its draft form, the draft guidance provides conditions under which the FDA states that it will generally exercise enforcement discretion for violations of the Food, Drug, and Cosmetic Act requirements. But it also notes that the agency may take action when animal drugs are compounded from bulk drug substances that, and they list 2 points. So let me just repeat that again. They may take action when animal drugs compounded from bulk substances that, 1, present particular human or animal safety concerns, or 2, do not meet the manufacturing product quality, labeling, or packaging requirements as required. The FDA also notes that regardless of whether the FDA intends to take action, the FDA may refer a case to the appropriate state entity. And the FDA intends to generally defer to state licensing boards for day-to-day oversight. Earlier this year, the board received information about compounding by California pharmacies using bulk substances rather than sourced products from FDA-approved drugs as required. In addition, the board received information that pharmacies may be compounding from bulk substances instead of from commercially available drugs, purportedly to reduce costs. To clarify this complicated issue, staff requested information from the FDA. The FDA's response is included in the meeting materials and includes much of the same information I just provided. To review this, I would like to ask Ms. Sodergren to provide some summary information about what board staff are identifying during inspections and how staff are currently handling the issue.
Thank you, Maria. So as part of our regulatory oversight of compounding facilities, we do partner with sister agencies as well. And sometimes what we find in the marketplace appears to not be compliant with federal law. What we have been doing is we have been issuing, we've been discussing the federal requirements, and in some cases we have been issuing an order of correction. An order of correction is not an enforcement action. It typically is requesting the licensee to evaluate their practice and take the necessary steps to come into compliance. As far as I am aware, the orders of correction that we have issued have requested that the licensee evaluate and develop a plan for correction, and we have noted that we would be reassessing the plan of correction next year as part of our oversight. I believe that there may have been some misunderstanding about what the board's actions were. These are not enforcement actions. We have not issued any cease and desist orders or any similar action in that regard with respect to the inspections that we have been conducting thus far. Thank you.
Thank you. Sorry for the delay there. I was on mute. Thank you, Anne, for summarizing what the board's activities have been. I would also like to ask DCA counsel Eileen Smiley to provide her legal analysis of the issue. Ms. Smiley, I'm hoping that you can provide the committee with information on your research as to current state of existing law, the draft guidance, and if possible, information provided by the FDA, which is included in the meeting materials.
Yes, thank you. As we've gone through the materials, I think the FDA has made quite clear, I've read the arguments from the supplemental materials, that some of the different organizations who submitted letters, that they disagree with the FDA's interpretation, but the FDA's interpretation is pretty clearly set out so far. The draft guidance is still only that draft, but the draft guidance would demonstrate when the FDA intends to exercise enforcement discretion. Usually when a federal agency states that, it means that the actions that they're going to use their enforcement discretion on would violate the terms of the statute. At this point, I've read the arguments from some of the supplemental associations and understand that some of them disagree vehemently with the FDA and its interpretation of the Food, Drug, and Cosmetic Act. But I would remind the board that this statute is a federal statute, that Congress entrusted the interpretation and administration of this act to the FDA, and the board simply doesn't have the jurisdiction to say that it disagrees with the FDA's interpretation of the act it is entrusted to interpret and administer.
Thank you, Ms. Smiley. Members, after hearing from Ms. Sodergren and our legal counsel, Ms. Smiley, I believe it is appropriate for the board staff to continue its educational efforts and to monitor for compliance while balancing the enforcement discretion and assessment of individual case-specific information. However, as we discuss this, we need to ensure we do not speak about any specific instance, inspection, or any case-specific information. Members, do you have any questions or comments for Ms. Sodergren or Ms. Smiley? Please remember to unmute your line.
Chairperson Serpa, I had a question. This is Jake Patel. The federal guidance on 256, is that finalized? It's not finalized, correct? They're still working on it?
From what I understand,
it's still draft.
That was Ms. Smiley answering.
It's a draft.
Correct.
Yeah, the comment period's over, but it's still a draft.
And I would also note, too, I think the FDA in the past, I think in 2012, issued draft guidance that was never finalized.
Gotcha.
Any other member comment?
Yes, yes, Dr. Serpa, this is Debbie Veal. I'm kind of going to follow up on what Dr. Patel just said. So what does that mean? I mean, so if there's a draft and it's never been finalized, does that mean it doesn't, if there's a draft out there, that means it doesn't really change what's already in the Food and Drug Cosmetic Act? Is that what that means?
I think what it means is that the FDA, I think as it said in the draft release, is that it has historically exercised enforcement discretion in this area under certain circumstances. What they're trying to do is give the updated guidance or more definitive. But at this point, with draft guidance, it means that's all it is it's draft guidance. There is nothing that is final out there from the FDA.
So sending, go ahead, Debbie.
Okay, yeah, so I was, so in listening to this, it sounds like, I mean, Maria, I appreciate you went through it very thoroughly, and I'm kind of trying to follow along and read to make sure this is absorbed in my brain and I understand what's happening here. So it seems like the Food and Drug and Cosmetic Act says if you compound from bulk for animals, it's a new drug, but then they go on and say, but it's really not something we're going to enforce unless there were those two situations, Maria, that you mentioned. One was animal safety, and I just off the top of my head, I can't think what the other one is. But so when we're going into pharmacies, is that what we're still, so is that what we're adhering to, that it's okay to, like, we're not enforcing and we're not asking for order of correction if they are compounding from bulk for animals, unless one of those two situations occur?
This is Maria. I know
Is
that
how we're enforcing it?
I know that Anne may want to add to this, but my understanding, and you can see that I had to do a lot of research to really understand the complexity of this, and that's the reason why Anne and Eileen were both commenting, because it is very, very complicated. But my understanding is such that the enforcement discretion falls to the use of the bulk product when or if there are alternatives available. If it is solely a choice to not use the FDA approved product in compounding, but to go to a bulk API source, that's a different situation than when there is no alternative and the API is the only thing available. That's why it's case by case determination and evaluation. In our state, it's evaluation with the inspector and the pharmacy on a case by case basis. And did I summarize that correctly?
Yes, thank you. I think the other thing that I would probably also say is that we are working with sister agencies and partner with experts.
Okay, and so you've dug into this, I think, a lot more than I've had the opportunity to, Maria. And so when I just read the notes, it says the FDA does not intend to take action for certain violations of the Food, Drug, and Cosmetic Act when pharmacists or veterinarians compound or oversee the compounding of animal drugs from bulk substances. And then in the next paragraph it says, but it also notes that the agency may take action when you're compounding from bulk if one, it presents particular human or animal safety concerns, or two, it does not meet other manufacturing, product quality, labeling, or packaging requirements of the FDA, of the Food, Drug, and Cosmetic Act. So I understand what you just said. So what you just said, is that probably not a concern, probably not the safety concerns is number one, but number two, if it's available in another form, is that what they're saying in number two? It does not meet the manufacturing, product quality, labeling, packaging requirements of the Food, Drug, and Cosmetic Act. Is that where that falls into?
I know that where I read that was actually in the draft guidance in a different section where it was specifically expands on those two comments. And in the draft guidance, there is a statement that talks about, let me find it here.
I think the draft guidance
there is.
It was attached, and I will be honest, I had a hard time wading my way through it.
So there's some definition about what a bulk drug substance is and what situations are, and I'm taking this out of context, but there's a statement in here that says there is no medically appropriate drug that is FDA approved, conditionally approved, or on the index of legally marketed, unapproved new animal drugs for minor species, blah, blah, blah. So that's where it refers to where there is no other choice, is how I interpreted it. No medically appropriate drug that is FDA approved or conditionally approved or on the index of approved drugs to be used for bulk compounding. So I didn't mean to get more complicated, but that's my interpretation, and I'm not sure if Anne or Eileen want to comment on that specific detail.
So do you think that that kind of comes into that number 2 exception? It doesn't seem like it's a safety concern. I mean, I guess I'm just trying to make sure that I understand, and I still have a little bit of do we really pay attention to, you know, guidance that's not published, but, you know, proposed guidance, or do we just wait until that's all, you know, until we have the final? But then, you know, Ms. Smiley said sometimes they never even finalize it. So I'm trying to wrap my brain about how we, you know, the best way for us to handle this.
Well, you know, we do have some considerations and something that we can talk about as we hear more of the comments from the members and from the public as to where to go from here. I do have some ideas to share, but I certainly want to hear from everyone on their comments. Members, are there any other comments? Or Ms. Field, did I cut you off? I didn't mean to. If you have anything else to share.
No, I think that was a good suggestion. I'd like to hear if there's any other comments from either other board members or perhaps the public that could help us. And I'm very interested in hearing what your suggestions are.
Thank you.
Maria, based on what I read and what I seem to understand, they seem to make a distinction between whether it's medically necessary or whether it's a choice because of cost. And therefore, it sounds like they're saying that if a decision is made to compound from the bulk substance because it's cheaper to do than to use something commercially available, that they would enforce against it. But if it's because of the fact that it's a better, you know, it's a better product for dealing with the particular issue, or if there's really nothing better available, then they won't. That's what it sounds like to me. Just my interpretation.
So President Lippy, that would be, so it would be drug by drug, product by product decision.
That's what it sounds like to me.
That would be super complicated to enforce, but
right,
it would be like a formulary, yeah.
And I could be wrong. It's just what it sounds like to me.
That's how I interpreted it also, and that's how I understand staff is moving forward with it. It's a case-by-case individual discussion. Any other member comment before we open up to the public? Hearing none, let's open up for public comment.
This is the moderator. I've opened the Q&A panel for requests for public comment. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" in the ask field and submit that to all panelists. At this time, we do have a request for public comment from Daniel Martinez. Danny, I've unmuted your microphone. You will have 2 minutes.
Thank you. So just for a couple of clarification items, the reason this became an issue in the first place is because these orders of correction are in fact having a de facto blanket prohibition, either through implying it or in some cases having inspectors outright saying that it is completely not allowed. And as I hear the discussion between the board members, I mean, it's very, very clear, and through the simple existence of the guide for industry, it's clear that the FDA is recognizing there is a veterinary need for compounding from bulk drug substance. The issue that I think is what's troubling is that the board is reading Code of Federal Regulation 530.13 on its face and not really taking into consideration the guidance or the veterinary need or the medical appropriateness on the need to compound from bulk substance. You know, the decision to or the policy decision to have to compound from commercially available products has the capacity to actually present patient harm. Specifically, there are fillers, and in our letter, I don't have time, obviously, in my 2 minutes to go through all of them, but in our letter, we describe various fillers and binders that have the capacity to harm or even kill animals. Fillers can also affect the stability and the potency of the compounded product, which results in either subtherapeutic or even in some cases super potent compounds, which will result again in patient harm. There's also the issue of, and I'm going to say this word wrong, palatability, where animals are just simply refusing to take the medication. And when they refuse to take the medication, it's not like you can tell a dog or a horse to swallow a pill or to take some medication. They
10
just
seconds.
take it. So what we're asking the board is to please reconsider these orders of corrections and wait for this guidance to be finalized so we have clear direction on what is or is not appropriate to compound.
Our next comment is from Gigi Davidson. Gigi, your mic is unmuted. You will have 2 minutes.
Okay, thank you so much. Good afternoon. I speak as an individual pharmacist who was a director of a state licensed nonprofit pharmacy at a College of Veterinary Medicine for 4 decades. This is indeed a complex issue that has spanned over my entire career. I don't want to debate FDA's interpretation of the federal statute, but I would like to point out that FDA has indicated a clear desire to provide regulatory discretion for use of bulk drug substances for compounding since 1994. I would ask for those of you old enough to remember this to flash back to the early 1980s when there was complete federal intolerance of bulk drug substances for compounding for animals. And the resultant void of guidance and the abundance of enforcement actions not only drove the practice of using bulk substances underground and largely offshore, it also caused significant animal harm and suffering to our animal patients. I appreciate and I'm grateful for the extensive research your committee has already performed. I have to commend you. It is far more extensive than most states have done in this matter. I also appreciate the comments that Danny Martinez just made. They're all spot on and couldn't be more on topic for this debate. I would like to raise some following points for your additional consideration. The biggest problem with 21 CFR 530.13 is that pharmacists have no access to veterinary-only approved drugs. They can't even begin to comply with the statute because the Animal Health Institute will not sell veterinary products to anybody but licensed veterinarians. The FTC has been unable to resolve this, and so it might be useful if your committee can draft strategies to negotiate with AHI or FTC and try to resolve this so pharmacists can even try to comply. The definition of compounded copies is not very clear in the FDA guidance.
10 seconds.
The committee might consider refining it. I would also add that lists do not work. You can see in the guidance that FDA has taken that into consideration for individual patients. Thank you for the opportunity to speak.
Thank you.
Our next commenter is from the California Veterinary Medical Association. Your microphone is unmuted and you will have 2 minutes.
Yes, hello, my name is Dan Baxter and I'm the incoming executive director for the California Veterinary Medical Association. Thank you very much for addressing the subject of compounding of veterinary drugs from bulk substances. The CVMA supports efforts to ensure that drugs used on animal patients are safe and effective. In this instance, however, we want to highlight the need to appropriately balance safety concerns with drug availability, because only through that type of balancing can proper veterinary care be rendered. The CVMA submitted a letter last Friday. It's in your packet at supplemental material item number 3. We hope you've had a chance to review it. The letter outlines our 2 primary concerns as follows. First, if compounding pharmacies are issued compliance or corrections orders to stop compounding from bulk substances, several key drugs used in veterinary practice will no longer be available. Critical drugs such as apomorphine, which is used for emergency toxic ingestions in dogs, will no longer be available. This drug, along with several others, may only be obtained from compounding through bulk substances, and there are many drugs that are not available in an FDA-approved form. Thus, the veterinary profession relies on and trusts compounding pharmacists to provide them. Second, it's our understanding that the FDA is not barring all use of bulk ingredients. In fact, the FDA itself recognizes that the veterinary industry needs these medications and can't get them from any other source. To that end, the FDA released GFI 256 to serve as a guide when compounding animal drugs from bulk ingredients. The comment period for GFI 256 closed 12 days ago, and at that time, the FDA had received over 3,000 comments on the draft. The CVMA, other state VMAs, and the AVMA contributed extensively to the comments. As a result of those and other public feedback, GFI 256 will likely be substantially amended.
10 seconds.
We'd like to request that the board consider these points and the others mentioned in our letter before proceeding any further, and we appreciate your time. Thank you.
Thank you.
Our next request for public comment comes from Dr. Ashby. And I am looking for you in my list. Dr. Ashby, this is the moderator. I do not see you listed in our attendee list by the name of Dr. Ashby. If you could please enter in the Q&A field the name that you signed in with so I can locate you and unmute your microphone. Madam Chair, we do not have anyone listed in our attendee panel by the name of Dr. Ashby, and I'm not seeing any response in the Q&A panel to my request for clarification. How would you like me to proceed?
Are there any other people for public comment?
No, that was our last request.
Okay. This is the last call for, I don't know if it was Mr. or Dr. Ashby. Please let us know who you are in the next few seconds here. Otherwise, we're going to close public comment. Anything coming up?
Nothing at this time.
Thank you.
Thank you. The Q&A panel is closed.
I'd like to thank everyone who commented on this very complex issue. It certainly is something I think that we are going to hear more about and discuss over time. There are many things to consider. My suggestion in moving forward for the board members to consider is I'm ready to make a motion, but would like to throw this out here first, is that I think this is such a complex issue that we should instruct board staff to monitor the issue and keep us informed as to emerging issues on the federal level, and especially regarding the draft guidance. I think the board should continue its educational role, and that the board should evaluate situations on a case-by-case basis as they come up regarding this federal law. So that's my suggestion, and I'm ready to make that a motion unless another board member has a different motion.
I second it. This is Albert Long. I second it.
Thank you, Albert.
Yeah, Debbie, I agree. I mean, Dr. Sharp, I agree too that until it's finalized and amended, we should play the role of educating and hold off on any notices of corrections.
Well, to be careful, that's not what the motion is. The motion is to evaluate situations on a case-by-case basis. I would not like, I don't think we should suggest that staff not perform any role that is appropriate for the case. That they need to follow not only state regulations but federal law on a case-by-case basis. So we cannot say no or never.
Gotcha.
So I just wanted to clarify that.
Maria, Dr. Serpa, this is Debbie Veal. I have a question for you about the motion, and I think I was maybe similar to Jig. So on the education, so it's on a case-by-case basis, and I heard the one public member state that one of the challenges here is that the commercially available products are available to veterinarians, but not to pharmacies. So I just want to make sure that when we're doing our education and we're comparing to what is commercially available, are we taking that into consideration as far as you know, or is there any way for us to find out? Because it seems like that could be a little bit of a problem. And I am an owner of small and large animals, and I do know that sometimes it's, you know, tricky to get medication down them. So I'm very sensitive to this topic. But anyway, if you could, you know, just kind of enlighten me on, you know, how we are currently handling that particular situation. You know, I heard what you said earlier. I just want clarification on commercially available. It's commercially available to the retail, to the pharmacy, correct?
Well, and not to comment on that specifically, I think that, you know, each case is different, not only for the specific needs for the patient, the animal, and, you know, we certainly want to make sure that we have safe and effective medications available at all times for everyone, human and non-human. But I know that Anne mentioned in her presentation a little bit about what the instructions and what the activities of the inspectors are now, and what is going to be planned to continue based on our discussion here. Anne, can you maybe repeat a little bit and maybe answer Debbie's question a little bit more, also about where do we go from here on an inspector level?
Yeah, so what I would say is every inspection is different, and the situations that we identify are different. And so when you look at the spectrum of what we're finding in the marketplace, there's some pretty big deviations in how practice is being conducted. And it would be the same in, you know, in something not involving an animal product, right? You look at the totality of the circumstances to determine. So if it's, I would assume that an inspector in concert with their supervisor and or when we bring in, you know, someone to assist us, is making a different decision when it's for a specific animal where there's been a specific thought and order versus large mass compounding from bulk products, potentially to circumvent costs. I think that those are two very different fact patterns and two very different specific issues that probably when evaluating them, when you look at it through the context of the federal law, probably one would be consistent with the FDA in terms of, you know, enforcement discretion, whereas perhaps the large scale process where you're potentially using bulk product to circumvent costs as opposed to, you know, another fashion, or where it's not a patient specific decision, might lead to some sort of a different conclusion, and that those might be where we are, you know, talking about federal law versus potentially also issuing an order of correction. I hope that's helpful.
Thank you, Anne. Debbie, did that help?
I think so. I think what you're saying is when it's being, you know, produced in mass, that's when it kind of raises a red flag. And I guess I mean, and I would tend to agree that that means it's not like an individual patient type of situation that you're answering a need. But I thought also that the line of delineation was also that, you know, if the pharmacy can't, you know, purchase the commercially available, and I guess maybe I think it does. I think that's, we're getting to, if you can't purchase it for a particular patient, then you make it for that particular patient. Okay, I think I'm good. Thank you. Sorry, I had to talk myself through it.
No, I appreciate that because it is a difficult balance to assure access, safety, and to assure that 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 everyone is protected, human and non-human in this case, um, but access and availability is equally as important.
Well, I guess the other thing that we heard is, from the enforcement point of view, is it maybe sounded like not all of our board inspectors were handling it exactly the same way. And so I think as, whatever we do, we need to, make sure that that there is uniformity in how they're handling it and we're all on the same page.
That's a good point. I know there has been discussion about the educational role, and certainly comments that we hear during board meetings are not under oath, so it's always everyone's personal impression and opinion. So we have to balance that. Are there any other member comments? Actually, since I have a motion, I need to ask Eileen and Noreen. Since I have a motion and we started with member discussion, do I have to open public comment again?
Or you can, that would probably be, well, you haven't changed the motion, just Debbie talked about that, so I don't think the motion has changed. If you want to, you could open it up again, but I think people will just be making the same statement they made before. But because you do have a motion, no one's actually I take this back, I'm sorry, since nobody.
I did second it.
Yeah.
Then you probably should open it up for public comment on that particular motion for the educational component and what you had said about taking it on a case-by-case basis.
Okay, thank you. Yeah, so since we're going to be taking, it's going to be taking action. So before we move on, are there any other member comments? Hearing none, let's open up for public comment on the motion.
This is the moderator. I have opened the public comment portion of the Q&A. If you would like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter I would like to make a comment in the ask field and submit that to all panelists. I will pause for a couple moments to allow time for submission.
Okay, thank you. So let's take a vote on the motion. Greg?
Yes.
Jig?
Yes.
Ricardo?
Yes.
Debbie?
Yes.
Albert?
Yes.
And the chair votes yes. As you noticed, I've gotten more informal as we go on. So I apologize if that seems to be too informal for everyone.
No, this is fine. That's fine.
Good job, Maria.
One more item that we'll discuss and then we'll take a break. I think this one will be a good one to finish up for this first half of the meeting. The next item on the agenda is item number 5, discussion and consideration of the use of peptides of compounding drug products under Section 503A of the Food, Drug, and Cosmetic Act.
Madam Chair, this is the moderator. It appears we did have one request for public comment that popped through just as I was closing the Q&A panel last time. Would we like to go back and take that comment?
I need to hear from Noreen and Eileen. What do we do since we voted?
I'm sorry, was there a request for public comment following the vote? Was somebody not able to get to public comment? Was that following the motion? Is that the problem?
Yes, it appears that they submitted the request just as I was closing the panel.
It seemed like there was an adequate opportunity for somebody to request public comment, but I will leave that to the chair to see if the public comment would to allow whether or not to allow additional public comment, and then to determine whether or not that public comment would lead the board to, I'm sorry, the committee to take another action, such as reconsidering the motion.
Okay, so if I understand you, I think that's Noreen. If I understand you. We would
Yes,
take the public comment, and depending upon what the comment is, we could reconsider our vote or move on.
correct.
Okay.
And I'll leave that to the chair to determine whether or not there was sufficient time to respond. I'm not quite sure. I wasn't counting or
Yeah.
We could hear it, Marie. We could hear it.
Yeah, I agree. I think that while there was sufficient time, I think it's our due diligence to for transparency to allow the person to speak, and then we'll decide if we need to revote or consider their comments. So go ahead.
Right, and we have to allow some leeway because of this format.
Yes. So go ahead.
Yeah,
and
I think that's a good rule to follow.
Okay, the request for public comment was from Daniel Martinez. Daniel, your mic is open. Please proceed. You have 2 minutes.
Thank you. I did actually have a clarification question on the motion. Is this motion suggesting that inspectors are going to be evaluating on a case-by-case basis, looking for any sort of compounding from bulk drug substances on the basis of cost versus medical necessity? Or are there other sort of metrics that are going to be taken into consideration for purposes of this education campaign? Because one of the things that we did mention in our comments was the medical appropriateness. I did mention that some commercially available products are harmful to animals with the ingredients that are in there. So I'd just like to know what exactly the metrics are going to be for this education campaign for the inspectors.
Thank you, Danny. I'll make a couple of comments here, and Anne may want to chime in. My understanding is that we are not limiting or including or excluding any of the issues in determining the evaluation of each case. Everything needs to be considered in total and be determined on a case-by-case basis. Anne, do you have anything to add?
No, I would echo what you said. Thank you.
Great, thank you. Members, having heard the last public comment, do you perceive that we need to change our motion or change our vote?
No.
No.
Okay, we're not taking an official
Yeah,
vote.
I don't think we should. I don't think we should change it.
Great. So not taking an official vote, but just by the preponderance of the consensus, I think we can move on to the next item on the agenda.
Right,
Eileen,
just to
Noreen, is that appropriate?
Yes, this is Noreen. Just to clarify, the board would not necessarily, the committee would not necessarily have to take a different action. The committee could simply vote to reconsider its motion, which would only determine whether or not it wants to reconsider taking a separate action, which is separate from actually taking that different action, if that makes sense. Yeah. But if there is no motion to reconsider, then you can move on.
Yeah, I think what I heard from the board members, and correct me if I'm wrong, is that there is no change in action, that we should just move on.
Correct.
Great, thank you. So let's move on to number 5, and then we'll take a break right afterwards. As I mentioned, this is regarding the use of peptides in compounding. This item, I wanted to discuss it now because it also relates to compounding practices, and information is in the chair's report as relevant to sections 503A of the Food, Drug, and Cosmetics Act. The conditions in the Act discuss when a compounded drug product may qualify as an exemption. That include the drug product that is compounded by a licensed pharmacist in a state licensed pharmacy or federal facility, by a licensed physician pursuant to prescription for an individual patient that is indicated the compounded drug is necessary. If, and this is very much similar to what we talked about in the past, but just to repeat a little bit, is if a drug product is compounded using a bulk drug substance, an active pharmaceutical ingredient, the bulk drug substance must comply with the standards of applicable USP or NF monograph, if a monograph exists, and the USP chapter on pharmacy compounding. If a monograph does not exist, it must be a component of an FDA-approved drug. Or if a monograph does not exist and the drug substance is not a component of an FDA-approved drug, it must be on the 503A bulk list. So those are the three ways that an exemption and exclusion can qualify for compounding. As indicated in the chair's report, over the past several months, staff have identified a number of pharmacies that are compounding using peptides. Board staff have confirmed with the FDA that many peptides are not eligible for exemptions provided by Section 503A. They do not satisfy criteria for bulk substance, nor do they meet the conditions described in the interim policy on compounding using bulk drugs substances under 503A. That's another document that was in our package. Board staff is conducting investigations where appropriate. Further, staff is aware of what is called a 483 observation. These are inspection reports from the FDA noting observed violations. As with the prior agenda item, the investigations are pending, and I request that no case-specific information be shared. Members, do you have any comments? So once again, just to reiterate, this topic is regarding the compounding using peptides and the FDA's response and the board's investigation of this practice. Hearing no member comments, making sure no member comments, let's open up for public comment.
This is the moderator. I have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of the screen. Type, "I would like to make a comment" in the Ask field and submit that to all panelists. I will now pause for a moment to allow time for submission. Seeing no requests, I will close the Q&A panel at your direction.
Thank you. Members, this item on the agenda is informational, unless the committee would like staff to take any action to provide additional education to the licensed public. So if we would like to direct the staff to provide more education on this issue, it remains informational. Would anyone like to make a motion? I heard someone unmute their phone.
Yeah, that was me. I unmuted my phone. I don't think we need to take any action at this point in time.
Great, thank you, Debbie.
I think if Ann hears that there's questions from the licensees, then we bring it back and perhaps figure out if we need to address it differently. But at this point in time, I think it's I don't think we need to do anything.
Great, thank you. So this time we'll take a 10-minute break. I see that it's 1:25. We'll get back together at 1:35 and consider and continue the agenda. So as of now, we're on break. This is Maria Serpa, and we're returning for the break for the Enforcement and Compounding Committee. We'll take a quick roll call of board members. Greg?
Here.
Jig?
Here.
Ricardo?
Here.
Debbie?
Here.
Albert?
Here.
Great, we're all here. Thank you. Hope everyone has gotten a little bit of caffeine as we get to the heavier part of our agenda. We're going to move on to item 6, discussion and consideration of draft information for respondents describing the administrative case process. Just making sure that that's what's on the screen. Members, as you may recall, during our last meeting, we received a presentation on the administrative case process. For anyone that missed the presentation, it is posted on our website. The presentation was excellent and had a lot of really great information. Following the meeting, it was suggested that it may be helpful to provide some general information to aid respondents in gaining a general understanding of the process and their rights. For our review is attachment 3 in the meeting materials, which includes a draft FAQ in addition to a flow chart to help licensees understand the process, their rights, and their responsibilities. If members agree to the concept, I suggest that we recommend to the board that staff finalize these informational tools. Their information could be posted on our website and distributed to respondents in the administrative case process. It is my understanding of the AG's office that they serve documents to respondents on the board's behalf. I'd be interested in staff exploring the possibility of the AG's office to include this information as a part of the package of information provided in the documents. So I suggest that as the motion that we finalize these tools and distribute them. Do you have a second?
Second.
Thank you. Any member comment?
Yeah, this is Albert. I think this is very important. I think a lot of our licensee does not know the right and how to approach on those cases. So I think we should educate them, so let them know the right and how they approach the cases.
I agree with you, Albert. This will be great help.
Any other member comment? Hearing none, let's go to public comment.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type, I would like to make a comment in the Ask field and submit that to all panelists. We will allow a few moments for submission of requests. At this time, we've not received any requests for comment. Would you like me to close the Q&A panel?
Please do. Thank you. Since we have a motion on the table, I'd like to call for the vote. Greg?
Yes.
Jig?
Yes.
Ricardo?
Sorry, yes.
Debbie?
Yes.
Albert?
Yes.
And the chair votes yes. Thank you. Moving on to our next item. Number 7, discussion and consideration of proposal to develop an alternative enforcement model. Members, this committee has had previous discussions regarding the potential of an alternative enforcement model to reduce both time and costs associated with the resolving of a disciplinary matter. The original discussion was based on a model used by the Physical Therapy Board that provides an option for pre-pleading settlement of a matter where the outcome is public letter of reprimand. Details of the law granting the Physical Therapy Board such authority is in the chair's report. Subsequent discussions included proposals to include 2 board members in the settlement process, or to include an oral conference as a part of the process. At that time, board counsel had concerns regarding these concepts and requested time to evaluate those suggestions. Recently, we also received a presentation of the administrative case process. As was shared during that presentation, the administrative case process has two fundamental guiding principles: due process of the respondent and public protection. Deputy Attorney General Jarvis reminded us that the state has a duty and a responsibility to ensure a licensee is competent and trustworthy. One of the concerns brought up during the public comment was that the administrative case process showed an assumption of guilt. To be clear, there is no presumption of guilt after the filing of an accusation. The board carries the burden of proof to establish a basis for discipline. Until that burden of proof is met, there is no presumption that the basis of discipline exists. As we begin our discussion today, it is essential for us to be mindful of the state's responsibility, as well as the policy goal we are seeking to achieve, which is to reduce both time and costs associated with resolving a disciplinary matter. Before we hear from counsel on the practical challenges identified on the various concepts previously discussed, I wanted to spend a few minutes reviewing the data provided in the chair's report. We need to make decisions based on facts. So if you look into the chair's report, there's a lot of details in there, and I'm just going to highlight a few things. When we look at the overall investigation statistics by outcome, it's important to note that over the past 3 years, only 11% of substantiated investigations result in a referral to the Office of the Attorney General. 11%. Another interesting point, to me at least, is to look at the data on the number of cases and the manner in which the cases are resolved. Of those 11% that actually make it to the AG's office, 32% of those result in a default decision, where the respondent does not respond, and 55% are resolved through a stipulated settlement, where the respondent agrees with a settlement before going to hearing. Only about 14% of the original 11% of all the administrative cases actually go to an administrative hearing. Well, I understand that's a lot of numbers, especially over WebEx, to how to really understand that. So I'm just going to break it down in a little bit different way. So if you look at page 7 of the chair's report, this is where I'm pulling the numbers, so if you wanted to follow along. So for an example, I'm just going to be looking at 1 year, fiscal year 2018 through 19. There were approximately 2,100 substantiated cases, of which only 364 were referred to the AG's office. Of those 364 cases, 105 defaulted, 165 settled, and only 49 went to hearing. That's 2% of the entire substantiated investigations for the year actually made it to a hearing. However, this still begs the question as to case time resolution for settlements. Also in the chair's report, you can see the average processing times. Of concern is that the average processing time for case resolution is longer for stipulated settlements than it is for settling a matter for a hearing. The report shows an average of 381 days for a settlement and an average of 318 days for a hearing. And just to remind you, that's on page 8 of the chair's report. I'm hoping that staff can explain why that may be the case. So I'd like to pause here and ask staff specifically that question regarding processing times.
So what I would say is there's pressure points in the administrative case process. And when a matter is set for hearing, there's a pressure point because there's going to be a hearing scheduled. When a matter is not set for hearing because there's going to be a stipulated settlement, there may not necessarily be that same drive for resolution. And so in those cases, negotiations of a settlement can sometimes take longer and be a little more extensive, especially if there's a lot of negotiation back and forth There's no, I would say that there's not necessarily a pressure point to submit mitigation and rehabilitation information. There's no drive to get that information, which is really part of the trigger to really getting the matter settled. Now, I want to just be super clear that I'm speaking in general terms. Every case is different, and, one specific respondent may, want to resolve the matter very quickly, and in those cases, we work to resolve the cases. So I'm speaking in general terms. A specific individual may have a different experience. I'm talking about overall what it looks like.
Great, thank you.
And this is Debbie. I was also wondering, when you look at on page 8, it says filing of accusation to hearing date. So that means that's just kind of the beginning. That's the hearing date, whereas the settlement is filing of accusation to stipulated settlement reached. So that's actually, it's reached, so it's at the end. So, I mean, when you're saying hearing date, isn't that kind of at the beginning? And so you get a date, and then and that's your hearing, and then there's like, a couple more weeks or whatever for a chance to, provide additional, it seems like sometimes there's additional information that comes in, and then the judge has to rule. So it seems like from hearing date to actually settlement might actually be another 30 days or whatever. So it still doesn't make it 381, but it could be, like, those aren't apples to apples. Do you agree?
Yes, I think that that's true, but I would say yes. So typically from the hearing date, depending on how long the hearing is, it's typically 30 days after for the board staff to receive the proposed decision to send to members.
Great, thank you. That certainly helps to clarify that portion of the chair's report. I appreciate that. However, I wanted to bring your attention to another data point that I find interesting, and that's on page 7. Give you a second to get to page 7. The data suggests, and this is about the statistics of adopt versus non-adopt. The data suggests that the board is far more likely to agree and accept a stipulated settlement negotiated by board staff than a proposed decision issued by an administrative law judge. Board members always serve as the final decision maker in all administrative cases, approving all outcomes. But I found that very interesting also. So I know I'm doing a lot of talking here, and I thank you for your patience while I review this information.
Maria, I have on the citation issue on 2017-18 versus 2018 and 19. That's almost 50% drop. And is it due to increase that we emphasize education and correction, or is it due to something else?
So which page are you on, Albert?
7 on the top of the
Overall investigations.
Investigation outcome citation issue. It was 2017-18 was 2,167, and then 2018-19 was 1,144. So that's all come down half.
Well, you look at the total number has also decreased by a third.
Yeah.
So there was a big change in that year, and I know that when we talk about the enforcement statistics, we do talk about those types of issues.
Yeah. So is it due to that we emphasize more education to the licensee to correct the problem? Is that just hit them on the head?
Well, and again, that's not part of this agenda item, but that is an interesting point. And we can talk about it when we talk about the enforcement statistics at the end of the meeting. Is that okay, Albert?
Yes, no problem. Yes, okay.
Because we're going to want to stay on about the alternative enforcement model. So I know I wanted to thank you again for your patience. I know that there's a lot of numbers and a lot of talking going on here, but I think it's important for us to review the original goals and the discussions that led us to where we are now and the number of cases that are potentially impacted. Like Debbie said earlier, also, she's new to the committee, and I also came in the middle of this discussion because this has been discussed a little bit, and it's moved around a lot. So having some review of the background and the materials I found very helpful as I prepared for this meeting. So moving back to our last presentation on the alternative enforcement model. As you may recall, Council indicated concerns with the proposal as well as possible changes that were being suggested at the time to the proposal. The committee postponed taking any action to allow time for Council to evaluate the information and inform us. So I do appreciate Ms. Smiley's time. She has developed a review and analysis of the proposal and the possible changes that we contemplated at that time. Her analysis is detailed and included in the materials that were in the meeting materials. I first have to acknowledge that Ms. Smiley identified some practical challenges with the portions of the proposal provisions and highlighted where such challenges may result in outcomes that have the opposite effect of the stated goals. I found that quite interesting, and I believe that those issues warrant our continued consideration and discussion. So maybe, Ms. Smiley, can you summarize your memo to us?
Sure. I can try. When I was going through the different proposal, because I wasn't a part of any of these prior discussions, I was just trying to look at what the proposal states in light of what the current process is and where some pressure points could be. Obviously, one of the biggest concerns is really the involvement of board members, just because of the potential quorum issues that could develop later. And also, although this proposal, the proposal to add section 4300.2 didn't specifically include a hearing component, I was told to take that into account because it does talk about that they can offer evidence with respect to rehabilitation or other type of mitigating factors. And the biggest concern is exactly how that hearing would be done. Would it be a paper process? And what would be the impact if a judgment is not reached or a settlement is not reached between the parties? So it's those practical concerns plus the board member involvement that becomes potentially problematic. What I was concerned is if there's going to be a hearing component, we don't reach a settlement, then are we going to have two hearings? Is that going to delay things longer, or is it going to result in greater costs with potentially two hearings? And particularly, who's going to administer it? Will we have a judge there? How are you going to determine what constitutes the type of evidence? If there's an oral conference or whatever you want to call it, who is going to make those determinations, and how is it going to be treated in the event that a settlement is not reached?
Maria, I have a question for Ms. Smiley, if this is a good time to ask.
I can, sure.
Okay. So to what you just said, so when you sit down with the two board members, there was a reference in your comments about, legal situations. At least that's what I remember reading. So would it be the two board members and the licensee, period, or would the licensee have their attorney with them? Because then if they had their attorney with them, then we would almost need to have one of our attorneys too.
Or somebody, be it the, possibly from the Office of the Attorney General. But that's where it gets confusing about what this conference is, because it shouldn't be board members alone with the licensee. So sometimes, usually at this point, settlement negotiations are generally kept private from people. It's really between staff and counsel. So that is an issue. Exactly what that would look like, and again, what would be the impact of it if a stipulated settlement isn't reached. So I don't, I don't think anybody had told me that it would just be the 2 board members and the potential licensee by themselves.
Yeah, but that makes me kind of nervous. And so then it seems like, so what are we expediting here? Because it seems like we have this meeting with the board members and the person and the licensee, and then I guess if they don't like it, then they now can move on to a stipulated, which is, you kind of remove the board members, but like some of the other people are all still there. So it's almost like they get, what, 2 swings at the same issues. I feel like
Debbie, I don't mean to interrupt.
I guess I'm with you, Ms. Smiley, that it feels like we would just be adding time, and then I agree with the recusal problem.
Before we're not really at board discussion yet, so before we continue on, at this point, what we are at is, Debbie actually brought up a good point. This is actually a good point. If you have any specific questions for Ms. Smiley regarding her information that she either presented or provided us to in writing, because we do have a little bit more, and then we'll have board discussion on the proposal in general. For right now, does anybody have any specific questions for Ms. Smiley?
Well, I may have. It depends on who can answer it. The other board, the physical therapy board, they're doing this. So the question is, how are they doing it? And how are they addressing those issues that Ms. Smiley is bringing up?
So we're going to talk about that. That's part of the board discussion.
Okay, that's fine.
So once again, we're going to have board discussion in a few minutes, but this was, Ms. Smiley really presented a complete written document that I had to actually read many times to get a few points out of. So if anybody has any questions regarding her testimony or her document, this is a good opportunity. You still will be able to do that during the board discussion too. So some of the things that I'm concerned about in reading the document and listening to Ms. Smiley, thank you very much for sharing your comments. I had like 4 things that I wrote down that I think are important bullet points. And that's that the licensee would have to agree to waive their rights to administrative adjudication and also admit to the allegations to participate in an alternative enforcement process. Any disagreement with the allegations would not qualify for the alternative model. And so that's important because that means that if the respondent wanted to quote unquote argue their case, it would not be via the alternative enforcement model. It would be via the administrative case process. The second thing that I saw that was what Ms. Smiley talked about, and Debbie mentioned a little bit here too, is that if an agreement is not reached, this could result in additional time and cost for a second hearing, in addition to the many legal issues that arise regarding the admissibility of the record. That was a very complicated point that I'm only highlighting here. There's also the discussion about if board members participate in an alternative process, that could be problems with the Opens Meeting Act. It could also require those members to recuse themselves from future discussions if the agreement is not reached. The other thing by having board members participate is, and you kind of mentioned it a little bit, is that this may be required to be a public meeting with board members present, and the discussion of the case would be in the public, unlike a settlement agreement, which is conducted by board staff and is private with the individual and the board staff. Those are the 4 major points that I took out of what Ms. Smiley presented for us. So I'd be interested on your thoughts about where we go from here, because I think we have several options to move forward. And in order, since we have a lot of comment, I'm assuming we're going to have a lot of public comment and a lot of board comment, I'd like to suggest a different process for us to have a productive discussion. So first, I'd like to move forward with having discussion by the board members and the public first, so that we can hear all the points and before we make a final deliberative motion. So I'd like to hold off on a motion until we hear and have a productive discussion. This is an important issue. Specifically, I'd like to hear both board members and public members' thoughts on the information that we received. And some of the choices we need to consider when we finish our first discussion is, should we continue to move forward in a development of an alternative enforcement model? Or should we look more closely at the process that's used by the Physical Therapy Board, which is a very different and limited process? Or should we take no action at this time? So those are the three things that I think that may be a result of our discussion. But again, before we start with the motion and start going down how we're going to move forward, I think we need to have discussion, open discussion with the members and with the public first. Just as a reminder, real quick, any change to our process, any alternative model would require statutory changes. So as we start discussing the alternative models or physical therapy board model or any other alternative model, I'd be interested in not only your comments, but some specifics on what would need to be accomplished to require those from a statutory issue. So I hope you give me this leeway to have a discussion first, and then we can follow up with whether we have a motion or not. At this point, I'd like to open up for member comment. You can also ask questions of staff or Ms. Miley too.
Dr. Smith, this is Debbie. So I kind of am interested in where Greg was going with the Physical Therapy Board, and in reading what they have here, you know, that you can issue a public letter of reprimand after it has conducted an investigation or inspection as provided for this chapter. So, so I guess the Physical Therapy Board, they have the option, if Debbie Veal comes before the board, then somebody at the board in the enforcement group, I'm guessing, knows that this is an option, because I would think this is not an option in all situations. So this is once again kind of my ignorance of not, you know, being through these before, and you've probably reported them out at full board meetings, and it just hasn't stuck in my brain matter. So, I mean, it doesn't seem like, you know, just kind of going for this public letter of reprimand. I mean, it's only certain times that they can even offer that. Is that how that works?
So, Anne, or is there anyone on staff that could speak to the Physical Therapy Board? I know that in the materials is the law that the Physical Therapy Board has, but maybe you could remind us.
Yeah, so as I understand it, and I'm happy to do some additional research if this is of interest to the committee, is we modeled the pre-pleading process from the Physical Therapy Board. It's my understanding that Physical Therapy Board has a range of outcomes similar to what we do, but they have the specific statutory authority to enter into an agreement where it's appropriate for a letter of reprimand as part of a pre-pleading settlement. But happy to do additional research if that's the desire.
So it's my understanding that and as a physical therapist, to enter under that discussion, the case would have to meet certain criteria that the eventual outcome would be a letter of reprimand, not anything further than that.
So that would be the only outcome that.
Yeah.
Now that doesn't work for a lot of our cases.
Well, I mean, so I guess it would have to get filtered before, and then, I mean, so that seems like that we're now once again adding more time because we're going to have to kind of determine the outcome. And I agree with you, Greg. You know, I guess you go into this, and worst case scenario, I get a public letter of reprimand. Best case scenario, maybe I get nothing. But I guess I'm trying to figure out, how is this any different than a stipulated settlement? Because, I mean, a letter of reprimand, isn't that possible out of a stipulated settlement? And do we ever give letters of reprimand?
Yes, we absolutely do letters of reprimand.
We do.
Right. So here's what I would say is we evaluate a case based on the seriousness or egregiousness of the violations, right? And at the staff level, when we are negotiating settlement as established in the board's disciplinary guidelines, the categories of violations really talk about the seriousness and egregiousness, and then you all provide your policy guidance in the disciplinary guidelines, even for the different categories. So a letter of public reprimand, and I think that it's, I don't have the language of PT board in front of me. Sorry, I'm looking at something else right now. I believe that it's, used for, lesser violations, and that's consistent with how we are using, how we currently use the public letter of reprimand as well. So I believe that we do use it. What is in the PT model is that it's a pre-pleading settlement. I do not believe that that's the only way that they settle cases. So if you're interested in exploring it more, staff could absolutely, research it a little bit more.
Well, so of course I have to ask you another question. You might just say that that's something you have to research, but I guess what I'm not understanding is a pre-pleading settlement versus our stipulated settlement. Is there just something about the pre-pleading that happens faster? Because in my view, if if we're going to give you a letter for reprimand, that's probably going to be a pretty fast, settlement on our end also, a stipulated settlement on our end. So I feel like, are we really gaining anything here? I mean, because we could do a fast stipulated settlement and give you a letter of reprimand if it's not anything real bad. I mean, so I'm trying to figure out, are we gaining anything here, or is this just
Debbie, I think the whole reason that the public brought this to our attention was they were trying to save cost, and I'm not sure that this pleading versus a stipulated settlement is going to make much difference in cost. I think the big problem in cost is that which goes to the AG, and this would not do anything for that because that type of case would not qualify for this type of pleading.
Wasn't it both cost and speed? And so I hear you for cost, and I guess I'm kind of more focused on the speed, because I know that that's been a concern in the past. The board is, sometimes it takes, what we think is a long time for something to kind of get resolved. But if it's something that would qualify for a public letter of reprimand, it seems like it'd be probably a pretty fast stipulated settlement also. Isn't it?
I would agree.
This is Noreen. I just want to add something really quick. I think I'm looking at the section from the PT board's licensing law that may have been referenced, and it says, in lieu of filing or prosecuting a formal accusation against the licensee, and then it goes on. So it does contemplate the possibility that this would happen post-filing, but pre-prosecution of the accusation. So it's not, at least in the PT board's law, the way I read it, it's not just pre-filing. How they actually do it in real life, that I don't know, but it does contemplate either way. I don't know that changes the speed argument, though.
Does it change the cost argument?
I don't think so.
Noreen, do you think it changes the cost argument?
Board costs? No, because if you've got the formal accusation filed, that means the matter has been referred to the Office of the Attorney General for the preparation and filing of the accusation, which would involve board costs. So no, I don't think it changes that portion of the analysis the way I understand the board is discussing it now.
So it sounds like it doesn't do anything.
I agree.
Yeah.
I don't think anything's broken right now. Before we start, even considering an alternative, enforcement model, it should work for the pharmaceutical board here. I understand it might work for other, like what's called the physical, what's called the other board that was mentioned
Therapy.
earlier.
Physical therapy.
Physical therapy board, but it may not, fit our model here until we have something that actually shows the, a cost saving or making it a lot faster. Then I think we should, look at those options. But until then, we're going to start changing statutes and, trying to create something without having a, pinpointing what we actually need. I don't think we're going to get anywhere. Anyways, I don't think it's we need to change anything until we can pinpoint something that's actually going to help us.
Yeah, I agree with you, Arnold. I mean, what is the problem? Is the public saying we're spending too much money on the AG's office? Okay, we probably agree with that, but I'm not sure.
No, I think they're saying the cost to them is tremendous to go through this, not at the cost, at the AG's office per se. Their legal costs and so on. So they're trying to find a way to reduce that. But I think maybe what we should do is hear from the public and see what they're suggesting.
Yes, so,
Maria, I have a comment.
go ahead, Albert.
Yeah, I don't know. I look at not at the cost. I'm looking at the public letter of reprimand. That's instead of probation, right? I mean, usually other punishment is probation, but a letter of a reprimand probably less. What I'm looking at is that on the last board meeting we have 3 cases of asking for early termination. All 3 cases that we asked them, why you asking for early termination? They all said that because the PBM is cutting off their contract. So if some of them, if they don't get probation, if they get letter of a reprimand, that probably don't put them in jeopardy of losing a contract. If that's the case, that something may be worthwhile.
Mm-hmm. That's always an alternative under the stipulated settlement process too. So that's a good point. Any other member comment during this discussion section? And then we'll open up to public comment during the discussion. And again, we don't have a motion. We'll be going through that after we fully discuss. Okay, hearing and members of we will have an opportunity to discuss after public comment also. So let's open up for public comment.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. Please click on the Q&A icon at the bottom of your screen. Type, I would like to make a comment in the ask field. Submit that to all panelists. And we have our first request from Daniel Martinez. Daniel, your microphone is unmuted. You will have 2 minutes.
Thank you. So the reason that this issue came in the first place, as you'll see by the letter that we submitted to the committee, we were the impetus for this alternate disciplinary model, not because of anything that's really been discussed here today, but more so because we had demonstrated that there were a lack of opportunity for a licensee who was accused of a serious crime to provide some sort of evidence to somebody, whether it's a board member, a staffer, anyone, in order to mitigate whatever it is that they were being accused of. Instead, they had to wait until the administrative case process actually started. And I do want to address because there was a comment made about the presumption of guilt. The presumption of guilt is in this proposal, which is not ours. I want to be clear, this proposal is not coming from CPHA. It says in the opening, notwithstanding the provisions of this government code, a licensee may accept a stipulated agreement to license discipline without and in advance of the filing. That is a presumption of guilt. There are other things that are in our letter, and unfortunately, in the 2 minutes that I have, I can't go through all of them, but I'd be happy to answer questions that we would like to see changed. But ultimately, the idea behind this alternate disciplinary process is when there is a mistake by either inspectors or board staff in terms of filing the accusation or not having all of the information present, that the licensee would have an opportunity to present that before a accusation is filed to the Attorney General. The cost component of this, obviously, is the having to hire an attorney in order to even respond to any sort of accusation. So with that, and I know my time's coming up here, I will be happy to take any questions about our letter or why we brought this to the committee in the first place.
Thank you.
Our next commenter is Joe Grisella. Joe, your microphone is unmuted. You will have 2 minutes.
Thank you. The real reason why we're doing this is we don't have fair due process right now. You get an accusation, you have to hire a lawyer, then you have to go in front of administrative judges, and then you have to go through a trial, 5 days, just to tell your side of the story. Nobody will listen to you at all. That is why you want this program. Because right now you have to go in front of a judge. The cost factor, just so you know, is extremely high. We're talking about $100,000 to $200,000 just to go through the trials. Then you got to pay for the Board of Pharmacies people. You're looking at $300,000 possibly just to tell your side of the story. So what we're asking is to have a committee with about 4 board members to explain my side of the story. You make a decision. At that point, you say yes or no. If you think it's bad, then you send it to the Attorney General. This is going to eliminate all your cases because you'll probably settle the case right then and there. You're going to save a ton of money, but we do not have fair due process right now. And there is just, you cannot tell your side of the story. And there's no really reason. If you have a fine, if you're getting a fine, you have a chance to go in front of not board members, but a board of pharmacy and explain your side. How many times have you gone in front of them and they said, oh, you were right. Yeah, that was a problem. Oh, the inspector made a mistake. But here, when we get to this level, you do not have any due process at all. You're just sent right to the judge. And I tell you that this is just not fair. And I'm gonna tell you, board members, especially pharmacists, if this were you would be very disappointed that you have to spend hundreds of thousands of dollars.
10 seconds.
And not only that, people just give up because they can't afford the money. I know none of you can afford the money. Let's not do it. We could do this for free in front of 4 board members.
Time has expired.
And I would ask for more time to talk later because I can see not many people understand.
Well, I actually would like to ask that individual a question.
Okay.
Because, so my question is, Joe Grisella, isn't that what the stipulated settlement could also do? In the stipulated settlement, you can give your side, and then if you don't like the settlement, then you can move on and bring in your lawyer.
No, it doesn't happen that way. You go right in front of a judge. You have to go first in front of a judge and then in front of a trial. That's how it's all set up.
No, you have a choice, Joe.
I'm telling you, I was there. I was there. They did never once allowed me to speak with them.
We're not having an argument, but there was a question, and Debbie, did you get an answer?
I understand his answer.
Okay, so thank you. The 2 minutes were up for public comment, unless, and the only reason we allowed for additional was because the board member had a question of the individual.
At this time, we have no further requests for public comment. I will close the Q&A panel.
Maria, I think I kind of see Joe's point.
Okay.
You know, I think.
Can we wait, Albert, for a second?
Yeah.
Because we're going to have additional comment. I just want to bring us back to being productive. So we had general discussion by board members and we had general discussion by the public to kind of understand the history, the circumstances, the needs, and the concerns. This is a difficult topic, and so just trying to keep us productive and to see where we go from here. So as I previously mentioned, I was asking everyone to hold off on a motion so that we could educate ourselves and hear what the issues are. A couple of suggestions, because I would certainly like to hear a motion from one of our board members. A couple of suggestions is, I see we have like 3 paths that we could choose to go through. That one is to continue to move forward on the development of an alternative enforcement model, and whatever that road takes us to. A second choice would be to look more into the process used by the Physical Therapy Board. Both of those require statutory changes. And the third would be to take no action at this time and potentially reevaluate this in the future. And unless a board member has another suggestion, I'm opening up to the board for a motion.
I would like to make a motion to take the first choice.
But before that, it seems like there's confusion on the part of board members as to what happens in the process with a stipulated settlement. Whether the stipulated settlement occurs before something goes to, a judge, or whether it occurs after that.
So President Lippy, would you like to clear that up, or would you like
Yeah,
to clear that
yeah,
up?
I'd like to clear that up also, yeah.
So President Lippy, would you like to do that?
Well, I would like our attorney to clear that up.
Okay, thank you. Ms. Smiley or Noreen?
So a stipulated settlement could occur anytime after the filing of an accusation. It doesn't have to go to hearing. So it could occur at either time, but it would be after an accusation. As the board remembers with some of the stipulated judgments that it sees, those will generally refer over to the accusation to give more context to the person signing it, that they have fully and with knowledge waived their rights under the Administrative Procedure Act. So it could occur at either time, but it occurs after the filing of the accusation.
Okay, so
just one more thing to refer to as you guys are discussing this. This is all also in the video diagram from a previous agenda item. So if you open up your board materials, there is a diagram of the administrative case process that we are suggesting to send out to respondents. So this is a helpful tool to keep forward as we continue the discussion. And I'm sorry, President Lippy, go ahead.
Oh, that's okay. I was just
looking for that. Where is that?
It's in attachment 3.
I was looking at attachment 4. Maybe it was in 5.
It's in attachment 3.
Oh, 3. That's fine. Okay. Thank you.
So, but the question I have is, from the point of hitting the accusation, and I mean, what costs are involved in that to the person that's being accused before they can get to a settlement, a stipulated settlement hearing?
Maria, would it be helpful if I provided a little context?
Please do, Anne.
Yeah, so a couple of things. I would say that, Greg, that's a question that we can't answer because it's on a case-by-case basis. It depends on what the respondent decides to do, right? If they're going to hire an attorney, their costs are going to be one thing. If they go pro per, or if they represent themselves, it's a different cost point. I would maybe argue that that's something that you all want to consider, but keep in mind what our requirements are and why we exist. The other thing that I wanted to talk about is Christina Jarvis gave that very detailed presentation during the last committee meeting, and it covered the entire administrative case process, including due process provisions. It covered the stipulated settlements as well as the administrative hearings. We do have that video on our website for anybody that would like to review it to kind of refresh their mind. I believe, as board members are well aware, when information is sent to you for a mail vote, you have a copy of the full record. So if it's an administrative case, you have the proposed decision, you have all of the findings of facts as laid out by the administrative law judge, the conclusions and everything else. When it is a stipulated settlement, you are provided with all of the relevant information, including all of the mitigation and the rehabilitation that the respondent has been provided. The goal is to give you, as the final decision maker, all of the relevant and necessary information so you have full records when you're making those decisions.
Well, I know what we get. What I'm asking, I mean, somebody has said that they have no voice in the matter. They cannot, defend themselves or offer information and mitigation or anything like that until an accusation is made. Is that correct?
Yes.
I mean, from the flow chart, that looks like that's correct.
Yeah, so here's what I will say. As part of the investigative process, which we're jumping back, right? We're jumping back a step. As part of the investigative process, it is a very iterative process. And we issue, sometimes it's orders of correction. Sometimes we're issuing notices of violation. Typically, when we're issuing the notices of violation, we are absolutely giving the the licensee 14 days to provide any additional information. So I don't think that it is an accurate depiction to state that there is no opportunity for the licensees to provide information, because I think that the record would demonstrate that that's probably not the case. And I'll leave it with that.
Okay, that's what I wanted to know.
Up there, when I look at this flow chart, and Maria, thank you for pointing us to this. I agree with you. It's very helpful. So the very first thing is investigation is complete and matter referred to Attorney General's office. So during the investigation, they could potentially, at that point, the licensee could provide mitigating and rehabilitation information as part of the investigation. Is that correct, Ann?
So yes, people can provide anything at any time. A lot of times we have said, these are the violations that we have, that we have identified, and then we give them 14 days to actually provide even additional information if they want. Typically through the investigative process, you're asking questions, you're seeking documentation, and then you're assessing the information.
It seems like they're asking also for an extra process before a case is filed with the Attorney General's office. You know what I'm saying? Because that's where the cost comes in, because they go straight to a judge and so forth. Even though we have our steps that follows the accusation, but I think that's what they're getting at is before you file it for the Attorney General's office, is there a way for the licensee to say, hey, hold on, can we at least, before you file it with the AG, can we at least show you what we have that might change your decision in filing this case? I don't know, it seems like that's where the step is.
I'm sorry.
Go ahead.
I would say, but that's before we even have issued an accusation. So how can, if we haven't accused them of anything, how
but
can...
I know, I think the argument is that they don't get those, it goes right. It's cost them a lot of money because it goes right to before a judge, or the first time they get to tell their side of the story or provide, any kind of rebuttal to the accusation is when they're $300,000 into it or something,
Just a correction.
But wait a minute. The only thing is, Ricardo, it's not an so if we haven't even given the accusation, how can they rebut?
And I'd like to,
I don't understand how we can avoid doing the accusation.
Yeah, I'm trying to understand. I know, Martinez, I'm trying to, I see where they want to go with it. Okay. I understand that they want to, have the alternative enforcement models we're talking about right now, which is an extra step. I'm just trying to point out that I think that's where it's at, before it gets real deep into them spending a lot of money for the attorney and everything else. They're wanting to be able. Yeah, I'm just trying to point that out, and I'm looking at the whole administrative the case process here, and it's a great graph that we have, by the way.
Yeah.
Thank you, Maria.
no, I appreciate that, Ricardo, because you are talking about a good point about adding additional steps before the administrative case process really takes off. But I did want to clarify just one point real quick.
Sure.
I did want to clarify that once the case process starts, box 1, it doesn't automatically go to hearing. There's opportunities before that for stipulated settlement and for other negotiation or other discussions. So it's not once it's filed, it's done and you're stuck with a judge. That's not necessarily the case. It's a choice.
Okay. So somewhere along there, I think they're looking for a change to be able to rebuttal, or at least to show something, some evidence to prevent it from going before the next step. I just wanted to point that out. I've done plenty of administrative cases, although I spend more time in the criminal part of it. But it can be complicated. Every case is different. You can't really say they're all alike. Like we may have one individual who spent $300,000 or whatever, but we may have another one who didn't. I don't know how many do or don't. I don't know if we have those numbers, but every case is different.
That's a good point. I don't know if we actually collect that data or if we have the right to collect the data, how many people choose to have representation and how many people do not, because that is in their rights. That's one of the things we want to educate people about. What are their rights? There's nothing that is one size fits all.
Yeah, and it's like when folks come to us to our hearing and stuff. We used to get complaints, or we used to hear that nobody wants to come before the board because it's bad. But my experience in the last 5 years, we listen to everybody, and a lot of times we take a lesser charge that they would usually be given. Had we all just said no problem, go with whatever the administrative law judge said. So I just want to point that out.
I'm not sure that's true, but when I look through this flow chart, it looks like I asked the individual that spoke, Mr. Grazia, whatever his name was, and according to the flow chart, there is a point. It says action taken by licensee, so they have a choice of either going to try to do a stipulated settlement, or if they can't come, and if that doesn't work, then they go to hearing. So, during the stipulated settlement, that's where you can provide all this mitigating information and about your rehab and all that stuff. And I think you can. I know pharmacists who go to stipulated settlement without lawyers. It's when I agree. Once you get to the hearing, that seems to be where people tend to lawyer up if they're going to. But so I feel like our process, and am I just ignorant here? But it looks like when I look at this, and just from my experience, it seems like they have the option of providing, mitigating, and talking to us through the settlement piece. And then if that doesn't work out, they don't have to accept the settlement, and then they can go to the hearing. So it feels like we're putting a stipulated, a pre-settlement up at the top. Kind of the same thing as settlement we already have going. A lot of this, you don't have to have an attorney. It's just really at the end.
I agree. I'm not proposing a step. I'm just trying to try to pinpoint where they want to go with it. Where the argument is, why it's been suggested, why we're trying to do this alternative enforcement model.
Well,
if we already have a process that's working, and unless we can actually, pinpoint where the problem is and try to resolve it without having to go through a whole bunch of changing statutes and so forth, it might be a quick fix.
Well, it sounds
I
like
don't see anything wrong.
Ricardo, it sounds like what they're asking for, though. They're asking for an alternative procedure that includes board members to listen to them. And I think, I think what I'm hearing from them is that they have the opportunity maybe to provide information to staff, but they don't have the opportunity for the board members to see anything. And because their alternative process that they're recommending does include board members.
Great. I think that's very important because, you never worked in a pharmacy before, and some of the public member never walk into pharmacy, behind the pharmacy, so you don't know exactly what it takes. Sometimes maybe it's reasonable and it's not reasonable to other people. And so is that to have a pharmacist listen to it, to give a judgment, I think is important to me.
Madam Chair, can I make, this is Noreen Marks, can I make one comment that might help give us a little context? It might not, but.
Go ahead. Oh, Maria. It's up to Maria.
Right.
It's up to Maria.
Maria, do you mind if I make
I was on mute. Sorry, go ahead, Noreen.
I wanted to point out that the administrative case process flowchart that's on page 100 of the material starts with the idea that the investigation has substantiated violations being referred to the AG's office for filing an accusation. And I think maybe what's missing is some information about the number of complaints that are filed that aren't substantiated, and they may not be substantiated because as part of the investigation itself, the licensee or the subject of the complaint is providing information to an investigator or an inspector that results in a report that says there is no violation. So while that flowchart is extremely helpful, I want to point out it starts farther down in the process. So maybe Ms. Sodergren can correct me where I'm wrong, but I think it's important to point out that the process begins earlier than that flowchart and might actually result in many complaints being dismissed for lack of substantiation of a violation.
That's a very good point.
Yes, it is.
Yeah, the before part is the part I used to have problems with before, when the case is filed both administratively and then also criminally, and we weren't filing those. At least we didn't have any numbers as far as how many cases were referred to the local district attorneys in different counties, and we didn't have numbers back then. But that's something different.
Well,
I just have a question. So if we were to add this step where pharmacists here, and I hear what you're saying, Albert, where in this process, I mean, I still think you have to have an accusation before the pharmacist, before you even come before a couple board members, and so we'd have to be careful. How many board members, because of the whole recusal, then they can't ever vote on it. So where, do you have the flow chart up here, Albert? So we have to get we have to have an accusation. So that's after box 2, and so the accusation you send to the licensees. So that's kind of the box 3 with do they respond yes or no. So is it about there that we would then have them, that they would have a choice that they could state their case before a couple board members if that doesn't work, then they would go into the stipulated?
Yeah.
Is that what you're envisioning?
Yeah. Well, that's what we mean by having an alternative process. Maybe we can have added two step onto it. Maybe give them chance to provide evidence to defend themselves, and then if that's not satisfied, then you go to the two pharmacists
So,
hearing.
so just to clarify for members, if you go back and you look at Ms. Smiley's documentation, that an alternative process would require the licensee to agree to waive their rights on adjudication and to admit to the allegations to participate in the alternative process. Any disagreement with the allegations, so any disagreements with the allegations would not qualify for an alternative model. So maybe Ms. Smiley or others can respond to that, but that may not be a choice. If an alternative model, it would be that they've accepted the allegations, is what I'm reading.
I mean, that even sounds worse than the stipulated settlement, because the stipulated settlement, you can go into that without admitting anything.
Well, and it's also private. So the stipulated settlement is a private discussion, whereas the alternative model may, depending on how it's worded or how it's structured, may require a public meeting if board members are present. So then the negotiation, quote unquote, would be public.
Well, why couldn't you have an alternative method where they wouldn't have to give up their rights first?
That's a legal question. Maybe
Isn't that, Greg, isn't that the stipulated settlement?
So that's a legal question. Eileen or Noreen, would you like to speak to that question?
Yes, the way this proposal that I was looking at was drafted was, it was just saying that the licensee may submit, just specified information, which is pretty much presupposing that they agree with the violations. If not, or the facts, and they want to dispute that, isn't that the purpose of a hearing?
Yeah, but who? Well,
but we could change it.
Who made up the proposal? I don't know who made the proposal.
We could change the proposal.
Right.
So this is Anne. If it's helpful, a couple of things that I just wanted to bring forward. One is that our investigations are done by licensed pharmacists, and they're also reviewed by licensed pharmacists. So we have a lot of pharmacist knowledge already in the investigative process, and feel like we probably already have that. And where we need additional expertise, we engage with experts through contracts to bring in additional expertise if necessary. So I don't want anybody to think that, we're moving forward willy-nilly. We are moving forward and referring something to the Attorney General's office where we believe that something is so egregious that it warrants removal or restriction of the license. When we look at the case outcomes, and we look at the board's actions specific to stipulations, by and large, you absolutely agree with the settlements that come before you.
That's true.
And that, to me, also speaks to the fact that staff are executing stipulated settlements consistent with the board's policy and its disciplinary guidelines and reflective of the collective decision of the board, right? So an individual board member may disagree, but the collective outcome of the vote is representative of you all adopting the decisions that are being presented as stipulated settlements. I think it's a different decision point with an administrative law judge. It appears based on the data that your non-adopt rate is a lot higher there, but that's outside of the board's purview. That's an administrative law judge rendering the decision based on applications of facts and presenting it to you. Nothing in what you all are proposing would change that at all, right? So it gets back to what are you trying to achieve here? We have pharmacist involvement throughout the investigative process, and based on my review of the data that Maria shared as well, it looks like as a board, as a collective board, you agree with the stipulated settlements that are being presented.
You're absolutely correct. I've never seen, in 12 years, I've never seen any case that came to us that appeared to be without substance?
Well, the bottom line is that I think the licensee would like to see that, a chance to present their side of the story without incurring a large sum of money. So if we could provide that opportunity, I think that probably will solve the problem.
Okay, I think we already do through the stipulated settlement.
So, well,
I think we kind of go back to what Ricardo said earlier. I mean, is there anything broken here that we're trying to fix? And
Well,
the more
maybe
we talk, I think
move
already have
the
a good
step,
process.
maybe move the step a little forward. So before I think if you too far down the line, they probably incur some expense already. Maybe
I'd
you
like to
can move it up.
hear, I'd like to hear again from the public as to why they believe that the stipulated settlement process does not meet their needs.
So where we are in the process, we could go back to discussion. But I was hoping that we could come close enough to have a motion, and then we would have more discussion because we have
Yeah, we can do that.
a motion. The other thing is to consider is, going back to some of the things that are in the documentation about our role and responsibilities. So our role is, obviously I'm repeating, talk about is the protection of the public and to deal with our statutory obligations as a board. Also, we're looking at opportunities to save time and cost.
Yes.
Not only for the state, but for the individual. That was one of the comments that came from the public. And the other comment that was made was regarding, I lost my train of thought here, regarding the additional step. I'm sorry, I lost my train of thought, so I just don't want to go through that. But, looking at what we need to do or required to do and should do ethically, morally, and statutorily as a board, rather than what may necessarily be what we quote unquote think of as a good idea. If something is a good idea, then it needs to be fleshed out and discussed and really determined before we move down a path of statutory changes or implementation. So I'm not
absolutely.
Yeah, Maria, I agree with you. I think we need to slow it down and really, before we start making decisions or proposals and moving things forward, we should really start crossing those T's and see if it's even doable.
Right. So I'm not trying to shut down discussion. So, but I don't think that we have.
I mean, Maria, I'll make a motion.
Go ahead, Debbie.
I'll make a motion, but before I do that, I think Albert was going to make a motion when we started this discussion, and my motion is going to be the exact opposite of his. So, he did speak up first, and so I feel obligated that if he wants to make a motion,
I would like to make a motion to look further into it, where we could both save money for the licensee and the state. Maybe we could just, rearrange some of the procedure or the step so they could get a chance to present their side of the story before they incur a large expense.
So, Albert, are you saying that you don't want to take any action today but continue to study it?
Right.
I'll second that.
Believe it or not, I'm in agreement with you. So I would second that.
So before we continue, so the motion I hear is that we take no action at this time, but continue to evaluate the issue, period, I guess.
Yes, I agree. That's the
Albert,
motion.
does that
Are you
capture?
in agreement, Albert?
Yeah, I agree too. I think that's a good motion. I mean,
Albert,
slow it down.
Motion?
Yes.
Okay, and so that's been moved and seconded. So now we can have the official member comments on the motion. I think we've had a lot of comments.
Yeah.
This is great, an opportunity to hear more from the public. So we do have public comment on the motion. And so if you want to open up the lines, moderator, we're ready for public comment.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. If you'd like to make a public comment, please click on the Q&A icon on the bottom of your screen, type "I would like to make a comment" in the Ask field, and submit that to all panelists. At this time, we have a request for public comment from Daniel Martinez. Daniel, your microphone is unmuted. You will have 2 minutes.
Thank you. I would like to request that this motion be withdrawn. And for the reason being is because the conversation that has taken place on this issue today is wildly different from where it originally started back in 2019. Again, this is an issue that CPHA brought forward. We are proud to champion this issue, but this particular proposal was not developed by CPHA. In lieu of the current motion, I would ask that the motion be rescinded and instead have at the next meeting, place this on the next meeting's agenda so that now that we know where your head's at in terms of the board of the committee, we can present exactly and clearly what it is we're asking for so that could be considered. That would be the request that we would make, and we would ask you to please rescind the current motion and instead put this on the next agenda so that we can come and provide you with a clear ask of the committee.
But Danny, this is Debbie. Why do you think we need to rescind the motion? Because I think our motion actually does exactly what you're asking it to do.
So I'm saying that because maybe this is the way I'm hearing the motion, and I apologize. Sometimes you can't really read this through the internet.
He just want to put on the next meeting agenda.
Yes, we want to make sure it's discussed and not just kind of, tucked away. That's all.
No.
I mean, I think we're good with that. We're not going to make it. I think our motion is not to make a decision today and to continue to study it, and so we can put it on the next meeting agenda and you can do a presentation. Oh, well, I mean, that's actually.
Yeah, I agree with you.
Yeah. I could amend that to put on the next meeting agenda.
Okay, thank you.
Hey, Danny, and I think what we're looking for is to give a heads up that I'm thinking here is the actual solution to it. I know we want to fix something. We want to fix not having to spend so much before you even see a judge and so forth. But the solution, at what step how do we actually fix it?
Correct. And actually, if you refer to the letter that we sent on this issue, we actually did come up with what we thought was a solution back then, in terms of creating a committee, an advisory committee. This committee was very clear that was not the solution that they wanted. So that message was loud and clear. But yes, absolutely, we will bring forth a very clear and concise proposal so that you guys can take it under consideration.
And keep in mind, there's statutes that have to be changed and a whole process. So it's,
yes.
I need to bring everyone back together. Where we are now in the process is we have a motion and it's been seconded and we're in the middle of public discussion.
Right.
We finish public discussion and we can vote on the motion as it stands. But right now, the motion is to take no action and to continue to evaluate and study the issue. And we're in the middle of public comment. So is Mr. Martinez's 2 minutes up?
Yes. And we have another request for public comment from Rick Rhodes.
Thank you.
Rick, your microphone is unmuted. You will have 2 minutes.
Yeah, thank you. I appreciate that. I do respect the legal process. It's very complicated, and there's a lot that goes into this to make sure that we are protecting the public and regulating pharmacy properly. The challenge is I'm not a lawyer, so I think some of these terms and things get very confusing, like all of us. But I'm a pharmacist. And I have never, thank God, I've never been through this process of having to do a stipulated settlement. I was, however, a witness. I've been a witness before, and so I've kind of been a part of that. I've seen how it's gone, and I don't know how many of you have been a part of that. And I can't speak from a lawyer standpoint, obviously, because I'm not, but as a pharmacist, it's very intimidating because the conversation, at least, and you can correct me if this is not the way it typically is, but there is a judge that's there, and you're negotiating in the room with the Deputy Attorney General. And so it's not a very easy conversation to have. It's very intimidating. And I mean, if it were me, I would have a lawyer. I don't know how I would be able to do it by myself. So I think as any pharmacist that goes through that, I do hear a lot of comment that that's the best way to negotiate. I'm just saying, and I have been a part of it as a witness, and man, is it very, very intimidating. And you are going, at least in that situation, you're negotiating with a Deputy Attorney General, and that's not very easy to do. So thank you very much.
We have another request for public comment from Joe Grisella.
I'm sorry, did you hear my comment I just made?
No.
Okay, I just wanted to comment on, just to clarify, is that the respondents do not negotiate with the Deputy Attorney General. That's the action is hearing in front of a judge. The negotiation is done with board staff during the stipulated settlement process. And so I just wanted to clarify that the Attorney General is not involved in the negotiation. Thank you.
Joe Grisella, I have unmuted your microphone. You will have 2 minutes.
In addition to what she just said, that whole process, you have to hire lawyers. It does cost a tremendous amount of money. And that's why we want to have this prior to it and to state your side of the story. That's all it's asking. I highly recommend, because many people here are new, to hear the CPHA proposal. It's very good. I want you to know that all boards of pharmacies have this. The medical board has this. Unfortunately, we're the only board. And in fact, at one time, this board did do this 15 years ago. They had a process where you were able to listen to the pharmacist before it went to the Attorney General. See, that's the key, before. Now, if you think it should go to the Attorney General, you send it. But at least I had my chance to make a comment and state my case. And also, too, this creates oversight, which unfortunately we don't have no more. It's the oversight by the Board of Pharmacy. So with having 4 board members, you got oversight now all of a sudden. So there's a lot of good things other than just saving money. And keep in mind, once this goes to the judge, you're probably going to get your license revoked, stayed, placed on probation, probably going to lose your pharmacy. And it's not uncommon for pharmacies to shut down just because of this revocation and probation, as one of the board members said. So that's why we want to talk this out prior to that. And please do take a look at CPHA's proposal. It's very good. Thank you.
And that was our last request for public comment. Would you like me to close the Q&A panel?
Please do. So members, we have a motion, but I understand by some of the comments that were made that there may be concept to rescind the motion and put a second motion. I leave that up to Albert and whoever second.
I think he just wanted to amend his motion to bring it back to the next meeting.
Exactly. That's amend the motion to put this on the next meeting agenda.
What is this? A continued evaluation and discussion, evaluate what, can you give me some specifics? Is that enough to say, Albert, like that?
Yes.
To continue to discuss and evaluate, study, or you're not, okay.
Yeah, yes.
Okay. And then
yes.
So, who was the second?
Debbie was, and I'm okay with that.
Okay. So since we have a new motion, we have to have more comments. Any member comment on the second motion?
No, they're not.
Other than it's, I'm glad he's amending it to that so we could slow it down and give it some more attention and hopefully come up with a good solution.
I appreciate the thought.
No, the bottom line is that what we will try to do, make it fair to both sides and save money and have a win-win situation.
Great, thank you. Any other member comment? We will have to go to public comment again. Okay, let's open for public comment on the new motion.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. The instructions are displayed on your screen. We will pause a few moments to provide time for submission. Seeing no requests for comment, would you like me to close the Q&A panel?
Please do, thank you. So we'll move on to take a roll call vote. Mr. Lippy,
Yes.
Mr. Patel,
Yes.
Mr. Sanchez,
Yes.
Ms. Veal,
Yes.
Dr. Wong,
Yes.
and the chair votes yes. Thank you all for your patience and consideration and sharing during this very important topic. We will revisit this again next time. Moving on, next agenda item is number 8. Discussion and consideration of proposal of board's policy encouraging pharmacies to report law enforcement acts involving drug diversion by an employee. During our during our January 2020 board meeting, the board approved policy statement intended to encourage pharmacies to refer drug diversion cases to local law enforcement agencies for possible prosecution. Such referral would be in addition to the mandatory reporting of the board. This is in page 8 of the chair's report. Data provided in the meeting indicated that the referrals to law enforcement are occurring. However, it may not be occurring with the frequency that the board would expect. I agree with this concept and move to include in the board's policy statement communications with licensees when seeking additional information regarding drug losses. So the policy statement is in the materials, and we're looking at providing more communication to licensees regarding the policy. Is there a second?
I second.
Any member comment?
Yes. Since, during my years in the board, we see so many diversion and go unpunished. So that's what I think keep this narcotic problem, opioid problem in this country, because I think they feel they get away with it, and it's keep coming. You get one, another one come along. So we have to figure some way to stop this system. So to preventing, make it so easy for them to, divert drug without any punishment.
Thank you. Any further member comment? We're ready for public comment.
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type, "I would like to make a comment" in the Ask field and submit that to all panelists. We will now provide a short, brief recess to allow time for submission.
Okay.
Seeing no requests, I will close the.
So you're ready to take a vote? Mr. Lippy?
Yes.
Mr. Patel?
Yes.
Mr. Sanchez?
All right. Yes.
Ms. Veal?
Yes.
Dr. Wong?
Yes.
And the chair votes yes. Thank you. Moving on to item number 9, discussion and consideration of disciplinary cases and incorporation of ethics program requirement. As included in the meeting materials, the requirement for the ethics program are established in regulation. Recently, the board received a request to discuss what appeared to be a decrease in the number of disciplinary orders that include as a condition of probation completion of an ethics course. Information about ethics programs are detailed in the chair's report on page 9. So I only will highlight a few items. The program must include a minimum of 22 hours, at least 14 of which are contact hours and at least 8 additional hours for preparation, evaluation, and assessment. The course objectives are listed in the chair's report, and the cost of interest is that the program that is provided by PBI Education is $1,875, $1,875. Data on the number of individuals that have completed the PBI training is provided in the report also. Regrettably, board staff was unable to secure data from IMQ. IMQ was another course provider, but has since closed. So as a result, the data does confirm there has been a decline. And I'm not sure if staff have any comments regarding the ethics course and incorporating it into disciplinary cases.
The only thing that I would indicate, and I think that, there are a number of respondents that now proactively complete the ethics course in advance of settlement and provide it as part of the mitigation. And so in those cases, then it's not going to be included in the settlement because they've already completed the ethics course. That may be part of the reason for the decline.
Great, thank you. Members, do you have any comments? I think we're ready for public comment.
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" in the Ask field and submit it to all panelists. We will pause for a few moments to allow submission.
Okay, seeing no public comment, I think we're ready to close the public comment.
I will close.
Members, this item is informational unless anyone on the committee would like to make would like to take an action and suggest a motion. Hearing none, we'll move on to the next item. Review and discussion of
Excuse me, Madam Chair. There was a request for public comment that popped in just as we closed the panel.
Certainly. Okay, let's go back to public comment on the item on the ethics course.
The request was from Keith Yoshizuka. Keith, your microphone is unmuted. You have 2 minutes.
Thank you. Thank you for bringing up the item on the agenda. I'm the one that requested at the last meeting. I noticed, because I do research in this area, I noticed that the percentage of cases requiring taking an ethics course declined from about 75% 2 or 3 years ago down to about 20% more recently. After I had made the request, I heard through informal channels, and it's not scientific or not official, of course, that one of the reasons was the expense involved. And if this was true, then I personally would investigate going through our university to establish an alternative delivery to make it more affordable. So that's my comment. Thank you.
Thank you, Dr. Yoshizuka. I think that looking at page 10 of the chair's report, it will give you the information also about the number of times this was referred to in a disciplinary matter. And if that's of assistance to you, the board certainly would be interested in alternative programs that provide the same level of review. So I appreciate that. Any other public comment?
That was it at this time.
Great, thank you. Moving on to the next item. Attachment 5 includes the quarterly enforcement statistics. Since July 1st, the board has received 643 complaints and closed 635 investigations. As of October 1st, there are currently 1,345 field investigations pending. A breakdown of these cases is on page 10 of the chair's report. Before we go to public comment, I would like to ask the members if they have any questions or comments regarding the enforcement statistics. Hearing none, let's go to public comment.
This is the moderator. I've opened the Q&A panel with instructions displayed on the screen. If you'd like to make a public comment, please enter "I would like to make a comment" in the Ask field and submit that to all panelists. We will pause for a moment for submission. At this time, we do not have any requests for public comment. Would you like me to close the Q&A panel?
Yes, thank you. The last item on our agenda is the future committee meeting dates for 2021. They're listed in the chair's report. Members, before we adjourn, I'd like to remind you that our next meeting is scheduled per the dates on the chair report, which of course I neglected to write down here. And with that, unless members have additional comments, I would like to adjourn the meeting. Thank you all for your attendance and participation.
Great job,
Have
Maria.
a good afternoon.
Yeah, great job, Maria.
Yeah.
Good job.
Thank you all. We'll see you in a few hours here, or 45 minutes. 45
1
minutes.
o'clock, right?
Do,
Thank you.
can we just stay on? Do we have to go to the other website?